name is again Juanita Taylor from Dime Child Foundation, and Dime Child was selected as the local lead representative for National Mentoring Month. I have some information that I'm going to pass out to everyone. I don't know if you all are familiar with National Mentoring Month, but it's like a front and back hard copy, just so that you can kind of read over it and become more familiar with it. But basically, it's through Harvard School of Public Policy and National Mentoring Month, and it's a month that they've used to really encourage organizations throughout the nation to focus on mentoring and to get organizations to try to get out there, recruit more mentors, and bring more recognition to mentoring. Of course, like with everything that's going on in Chicago over the last few years, there hasn't been an organization that has been the representative, so we just kind of, stepped up and had a conversation with them, and we were able to be like, the lead representative for this month. And so we really want to use this month to not only, of course, raise funds for Dime Child and other mentoring programs, and really bring more recognition to mentoring and the need for mentors, for organizations throughout Chicago. So we do have some programs that we run out of Dime Child, where we have where the students are able to connect with staff and mentors. There's a website for you guys to go to. It's just National Mentoring Month. And if you're interested in becoming a mentor, I have some handouts that are going around for that as well, if that's okay. Okay. So if you could just put your name, phone number, and address, and like I said, we're going to take this information and then refer you to an organization that provides mentoring. So it may be Dime Child, but more than likely it could be another organization. So I'll pass this around, so feel free to sign up. As far as the requirements and all that, normally with the standard mentoring programs, they like for you to meet with students, twice a month, do some face-to-face, in person, over the phone, email. Those are the standards, but of course, depending on the program that we try to refer you to, it could be different. But we want at least to be able to try to help them, organizations throughout Chicago recruit, hundreds of students. It doesn't have anything to do with like money or, a lot of people use that, but it does. DIME stands for Demanding Intelligence for Mentoring Education. Demanding Intelligence for Mentoring Education. Nothing to do with money, nothing to do with looking good, whatever.
Well, again, my name is Cynthia Wright. I am from Chicago Public Schools. I'm the project director of the Safe Schools Healthy Students Initiative. And I would just like to thank you guys for inviting us out. This is wonderful. I know most of us, well, some of us were at the meeting at Bradwell School, which was definitely a great opportunity for us to get to learn more about each other. But I am joined here by my colleagues under the Safe Schools grant, Ms. Deborah Moore. She works at SouthShore High School. Mr. Cornelius Spicer, he's a project assistant for Safe Schools, and Dr. Lisa Walker from Chapin Hall, our local evaluator. I have a couple of handouts. I did not make enough, and I'm just going to give you a very brief overview of Safe Schools again, and many of you probably heard this, as well as a couple other handouts, just a one page. One is a new one. It's about some of the mental health services we provide. But just to let you know, Safe Schools is a 4-year federal grant jointly funded through the U.S. Departments of Education, Justice, and Health and Human Services. CPS received the Safe Schools grant in 2007. We were one of 27 grantees. So again, it's a federal grant. We're pretty much charged with focusing on 5 areas. One is safe school environments and violence prevention, alcohol, tobacco, and other drug prevention activities, student behavioral, social, emotional learning supports, as well as mental health services and early childhood social emotional learning programs. Basically, our goal is pretty much to strengthen and expand upon a continuum of services and strategies to just promote safe, caring environments and healthy social emotional growth for children. And that's pretty much what our local goal is. The grant is specifically in South Shore. We're servicing 14 schools in South Shore. We're working with 10 early childhood sites in South Shore. We basically, for the first few years of the grant, we've focused our efforts on providing programming to schools. So this year we're very intentional about working with, at the community level, working with the community to try to help bridge some of the gaps that and some of the challenges that we're having in the schools. We can't just work in the schools and act like we can really have an impact. We definitely know we need a holistic approach, and we're really trying to figure out ways to work with the community, work with the parents, learn a little bit more about the community. And as most of you all know, Safe Schools Central Office, the Office of Specialized Services, that grant manages that department manages the Safe Schools grant, which we know is a challenge with trying to service one community. So again, that's why I say thank you all for allowing us to come here and talk with you and really being open to us and things like that. But we have some specific outcome requirements for the Safe School Grant. We are really, like I said, in those 5 elements, we are trying to decrease the students who didn't go to school because they felt unsafe to or from school. We want to have an impact on fights on school property, as well as decreasing the use of marijuana and other substances, as well as the provision of mental health services and support. So I gave you guys kind of a handout on what we're trying to do in the school. And one of the reasons why we've come here is trying to figure out what's already in the community, how can we partner together and see if there's ways that we can strengthen our relationship with you all, so that way we can better meet the needs of the school and your family. Currently we have multiple committees that we have a parent advisory group under the grant, so we have parents from the different schools that come together, and the focus of the parent group is to engage those parents that are not engaged in their child's education and what's going on at the school. We've created a referral process where kids are identified that may need additional support, and they are linked to clinicians within the school and then possibly referred out to the school. So these are things that we think and we know that we need the input of the community to help further this. And again, it's a 4-year grant. We're in the 3rd year, and we definitely want to help build some type of infrastructure to have some continuity of services with the youth that we're servicing, as well as the parents. So I sent around kind of a one-pager to talk about the mental health services and support. And what I would like to do is, if it's okay with Mr. Betts, if I can get a copy maybe of the sign-in sheet, or anyone's interested in working with us. I heard ETA Theater say, I'm not sure if you guys have art therapy. That's huge with our kids. If there's any way that we can think about resources that we can use from your agency, or talk about ways of partnering so we can better meet the needs of the kids and also the families.